Well, hi everybody. Thanks for joining me to hear the latest on climate change mitigation in the healthcare sector. So we're going to discuss the various roles that doctors can take and at both the patient level and I guess at the institutional level, wherever you end up. I'm wanting to share some positive, encouraging news as well as a case study about the progress of the NHS. You might have heard some of their work, but then I'll run through some practical examples of where we can turn risks into opportunities in healthcare to confront climate change. So you may have heard this quote it's come from Healthcare Without Harm. If the global healthcare sector were a country, it would be the fifth largest emitter on the planet. And on top of that staggering piece of information, actually, air pollution from fossil fuels contributes to 1 in 5 deaths globally as well. So obviously it's a health issue and it's of relevance to clinicians everywhere. So in Australia, the health sector represents about 7% of our national carbon emissions. Not something to be proud of course, and I'm sure that's why you're all here, is to do something about it. So there is actually cause for hope. There's been quite a bit of movement in the last little while, so I'm pleased to tell you. There's quite a bit on this slide, but it's important to, I think, draw on this encouraging news. Over 3,000 healthcare facilities have signed up to the United Nations Race to Zero, which is huge. That's obviously a global initiative. They're all committing to halve their emissions by 2030, which is absolutely just around the corner. So many of them are actually looking to achieve net zero emissions well before 2050 as well. So in Australia, the Uniting Care group, which includes the Wesley Hospital, has published some sustainability targets for 2025, and these actually include a commitment to reducing their carbon footprint by 70%. So I've just got a video link there in the slides, which you'll receive to have a bit of a summary look at how they're going to get there. So this year, also the Hunter New England Health Service announced their intention to be carbon and waste neutral by 2030. Also this year, Metro North released their first sustainability strategy, and I believe the Sunshine Coast is hot on their heels. Queensland Health is going about implementing an election commitment to address environmental sustainability. And they've actually drafted a comprehensive climate risk strategy with a risk assessment toolkit, which I hope will be forthcoming at some stage. And recent news, which is just incredible, is also that the Victorian public hospitals will be 100% renewable by 2025, as well as many other Victorian public state-run facilities like schools. So that will probably not happen just with solar panels on the roof, but I'll talk a bit about that later. In addition, this year there's been released a new global plan for decarbonising the health sector. And so at the end, I'd be happy to walk through some highlights of that global plan. But it's, I guess, the take-home theme for that plan, as well as this whole presentation, is that there are many different ways we can address carbon. Carbon is everywhere, so we can't just rely on changing to 100% renewable. There's quite it's quite an extensive task that we have ahead of us across the whole of the health portfolio and everything we do and everything we buy. There are opportunities. So I wanted to start by talking about your leadership voice. And often when experts in this field are asked what's the one thing people should take away from your advice, and they often say that it's really about being a leader. And being a leader is possible at any level of an organisation, and leadership is quite distinct from management as a skill. So it depends on your context and your confidence, but we do need doctors to help us drive progress because it's just so urgent, and doctors are incredibly trusted and respected, so your voice is invaluable. The good news is you're amongst friends. There are many others already around Australia and around the world who are helping people to understand the links between climate and health and what we can do about preventing global crisis from unfolding around us. Of all the many, many inspiring leaders I've heard speak about climate change in the last 20 years, I think none has been as compelling as Dr. Cheryl Holder from the US. I'd like to briefly play a 1-minute snippet from a TED talk that you can find online, but if it doesn't work, do watch it. It's 12 minutes, but the last minute or so is just so compelling about a doctor's role. Let's have a listen.
There is so much we can do. As clinicians, our many patient contacts allows us to see things before others, and this puts us in an ideal position to be on the front lines of change. We can teach climate-related illnesses in our health professional schools. We can collect data on our patients' climate-related conditions by making sure there are billing codes to identify them. We can do climate-related health research. We can teach how to have green practices in homes. We can advocate for our patient energy needs. We can help them get safer homes. We can help them get necessary equipment in those homes when conditions worsen. We can testify in front of lawmakers as to the findings. And we can medically treat our patients' climate-related illnesses. Most importantly, we can help prepare our patients mentally and physically for the health challenges they will face using a model of medicine that incorporates economic and social justice.
And if you aspire to play a role like Dr. Holder, I can assure you that there is plenty of support from organisations like Global Green and Healthy Hospitals Network, Doctors for the Environment in Australia, and the Climate and Health Alliance. So a lot of the colleges also have made some networks around sustainable healthcare, and the AMA also has written policy statements and delivered campaigns. So whichever organisation you align with, they can provide you with useful resources and supportive networks to help you along the way. So it's case study time. And NHS is very well known for its work, so I'll just quickly scoot through this because you've probably heard a bit of it before. But let's look at some of their learnings. Over a 10-year period, the NHS actually managed to reduce its emissions by 11%, which is kind of modest in a way for a 10-year period. And it saved £2.4 billion, and that's probably a more eye-catching figure. So this was actually during a period of increased activity, and this is the challenge in healthcare because our populations continue to grow and require care. So how did the NHS actually do it? So you'll see from this graph that tracks their progress over 10 years that there's no one standout really. There's no silver bullet. And in fact, you can see many opportunities right across the board for reducing the emissions incrementally. And you'll see from this diagram that addressing each of these areas of work can be a little bit bumpy. This graph came from a journal article that described certain years where things went backwards. But you can see it's right across the board. The action included pharmaceuticals, for example, food, waste and water features, and even the anaesthetic gases and the measured dose inhalers as well, which you might have heard has a propellant that is an ozone depleting substance as well as a greenhouse gas. But energy in buildings did actually come down quite a bit in the last several years. And that's actually because the fuel mix changed in the electricity grid, I imagine. But at this point, I should acknowledge that their mix is very different from Australia. So the most notable shift you can see in this graph in the UK is the decline of coal, the black line that dips sharply after 2012. So nevertheless, progress needs to speed up, obviously, if we're going to reach net zero in time. And I'll talk about more of that in a minute. But first, I also wanted to stress that the big wins for emissions reductions in healthcare are not only in the energy mix, as I've stressed. As you can see from this graph, the NHS found that waste, for example, has relatively small impact on total carbon. And you can see that decisions on medical instruments and pharmaceuticals are really right up there. So now what's really exciting about the NHS is that they've just recently become the first public health system in the world to commit to net zero by 2040 with an interim target of 80% reduction by 2030 or thereabouts. Although there is a high-level plan that you can get online that sort of illustrates how they plan to get there, the NHS lead on sustainability, Nick Watts, admits that the path is not entirely clear yet and there's much work to be done to work out how they're going to proceed. So in the meantime, there are plenty of areas we can influence in our own patch. I'll outline just a couple of opportunities for action, a handful anyway, particularly those relating to hospitals, which are obviously very emissions intensive organisations, and I'm sure you'll all spend some time in hospitals. Let's talk about anaesthetic gases. So at my own hospital, I see the consumption of gases like desflurane come down year after year. And to their credit, the anaesthetists have actually taken this gas off the trolleys, the anaesthetics trolleys in theatres. So anaesthetists all know that desflurane has more than 2,000 times the global warming potential of carbon dioxide. And as I said, it's also an ozone depleting substance, which, is crazy that they're using it because there are alternatives readily available. However, nitrous oxide is also quite harmful as a greenhouse gas, but it is more difficult to address. It's still very popular in childbirthing, and more work needs to be done in this area. But for now, I'd really recommend, based on what the anaesthetists say, that just being frugal with it and discussing options with mothers can help. Actually, I'm told this is clinically advisable in any case. Okay, let's start talking about everybody's favourite topic, waste opportunities in healthcare to reduce emissions. So waste and recycling are often considered the first rung on the ladder as people climb into their role to reduce emissions in healthcare. And the circular economy is certainly gaining momentum in Australia and around the world. But in healthcare, there's a particular opportunity to avoid unnecessary clinical waste, which is about 5 times the cost of other waste streams, whereas most people in this space would just go directly to recycling as the topic they want to focus on. So clinical waste is actually mostly plastic, and it's often incinerated depending on your waste contractor. And obviously burning plastics releases harmful dioxins into the air that we breathe. In fact, only a small proportion of the clinical waste actually must be incinerated by law, including cytotoxics. So do ask questions of your waste team as to where the clinical waste ends up and whether it's incinerated. Instead of incinerating, you can actually find providers who will macerate, autoclave and send it to deep landfill instead. Either way, training in good quality segregation is useful, and also just preventing too many clinical waste bins so that you don't have people using it as a general waste bin and putting their Coke cans in there. Reusable sharps containers is another way you can reduce clinical waste because those sharps containers that are single use end up in the clinical waste stream. So moving on to energy, one question I'm often asked is, why don't we have solar panels? And while it would be ideal, unfortunately for most city-based high-rise hospitals, the ratio of the roof area to the volume is not great, and the panels would generate as little as 1% of the hospital's energy needs in this scenario. Nevertheless, hospitals can source renewable energy from off-site solar and wind farms through a power purchase agreement. Or alternatively, they can buy accredited green power, which you can also do at home. And another alternative is to buy what's called renewable energy certificates, or otherwise known as LGCs, large generation certificates. So they need to be what's called surrendered in order to claim that you're purchasing renewable energy. So it's sort of an off-site generic way of buying renewable energy integrated with your retail offering. But before this happens, obviously it's advisable to try to reduce your consumption and be as efficient as possible. And that really requires an ongoing effort, like a quality improvement system with the plan, do, check, act cycle of pushing the boundaries year after year. Many hospitals don't even consider this simply because they don't have access to the expertise or the faith that they can put together a business case to argue for upfront investments or upgrades, which cost money at the beginning but will deliver savings over time. Moving on to procurement, this fits into Scope 3 emissions, as does waste. And Scope 3 emissions, or at least procurement, represents about 60% of the total hospital emissions in the NHS at least. So a big part of procurement costs and emissions from pharmaceuticals and medical instruments are a major proportion. Procurement is essentially about working with suppliers and working with them on both short and long-term sort of transformation of their products and the entire supply chain. So here are some examples of questions you might ask your suppliers or criteria, including whether they have certain certifications, what evidence can they provide to show their performance across carbon and energy and water and so on. And there's plenty of documentation that they could provide, but a dialogue is also really needed to take them on a journey with us. So there are a great many considerations or criteria for each product that you can also build into the tendering process in terms of both environmental and social footprints. And these days there's the Modern Slavery Act, which requires organisations over a particular size to really show that they are trying to address any potential for modern slavery in the entire supply chain of everything they buy. And you would be amazed at how big a problem that is. So if we're prepared to pay a bit more for products that don't involve child slavery, I think climate change is the next thing that we need to be asking people to ask of their suppliers. Just thought I'd mention that having ISO 14001 in place, which is the environmental management standard, is not actually a guarantee that your supplier is a good guy, but it's an excellent place to start. Independent advice is actually hard to come by, so often information you get from suppliers is just self-reported. So I urge you to make use of any resources that are around to guide you as to how to buy more sustainably and how to make the argument for that. So this is a picture of the front of the Global Green and Healthy Hospital resource that came out last year, and so I really recommend you have a look at that. Now to minimising unnecessary single-use plastics. I just wanted to give you a little overview of a project at the Great Ormond Street Children's Hospital in London. They had great success at reducing inappropriate use of non-sterile nitrile gloves. So they actually managed to save quite a lot of money and prevented about 18 tonnes of gloves from going into landfill. That's really hard to get your brain around, 18 tonnes of gloves. So it's incredible how much money and plastic can be saved just by asking staff to first think before reaching for gloves and do a little risk assessment as to whether those gloves are required. So we really should only be using those gloves if there's a risk of exposure to bodily fluids and medication, therapeutically active cream, and cytotoxics. Essentially, if there's no risk of exposure to these things, hand washing is preferred, and gloves are not an alternative to good hand hygiene in hospitals. Anyway, finally, this is the last slide. Let's think about your role as the gatekeeper of the health system. So ordering tests, treatments and procedures always incur some kind of environmental footprint. At the end of the day, it's not just, we can't just blame the manufacturers for the impact of these drugs. We need to be thinking about whether they're really essential at the time of ordering. So choosing wisely is an unbelievably awesome program that draws on the clinical evidence to confront some of these issues of over-ordering of tests and procedures. And the Australian arm of the program is administered by the National Prescribing Service. So it's a highly reputable program, and it's actually available in different parts of the world as well. The website is incredible. It's very vast and it's relevant for your role supporting patients. So it's all that clinical evidence all laid out for you very clearly. It has very user-friendly resources for both clinicians and consumers. And it includes videos and recommendations specifically for different areas of practice. I urge you to visit the website and consider whether less is actually more when it comes to delivering healthcare. So just to finish up, I urge you to get in touch with me if you need anything, any more resources, any links. Here are some for your convenience. And I'd also urge you to have a look at the global plan for decarbonising the health system. So just to summarise, there's a wide range of strategies that can address climate mitigation as part and parcel of your role as a doctor. And while there's no silver bullet and there are many opportunities to make inroads, just have some faith in your own ability to lead and influence the agenda at an individual level, patient level, team level, and even at the system level. It's really all hands on deck now and with climate change, so we urgently need to find a wide range of ways to turn risks into opportunities for our patients and our communities at large. Thanks for listening.